I'm Dr. Reintgen. I specialize in sports medicine and just completed my fellowship at the American Sports Medicine Institute in 2023. The type of conditions that I typically treat involve injuries associated with sports or athletic activity, such as sprains, strains, fractures, dislocations, torn ligaments like ACL, and tendinopathies. These occur in patients of all levels of activity, from professional athletes to college students, weekend warriors, high schoolers, and adolescents. As a sports medicine specialist, I also address overuse injuries, stress fractures, and chronic conditions like osteoarthritis. What I like best about what I do is the opportunity to work closely with patients to recover from injury and remain healthy. The ability to identify a problem, create a solution in clinic or through surgery to restore function in patients, athlete or not, is incredibly fulfilling. Sports medicine is also a field that is constantly evolving. This means practitioners are obligated to keep up to date with developing technologies and remain informed on medical and sports-related issues. Because each patient and injury are unique, I use a holistic approach that prioritizes the well-being and needs of the patient. By actively listening to someone's history and concerns, it allows us to engage in shared decision-making, which involves them in choices about their treatment while always considering their preferences and values. Every patient, regardless of station or level of activity, receives the absolute best care I have to offer. What sets Florida Orthopaedic Institute apart from other facilities are that FOI strives to be the very best for all musculoskeletal care. From the moment you walk through its doors, you're greeted with an atmosphere of professionalism and warmth. The clinic boasts a team of skilled orthopedic specialists who are not just excellent providers, but compassionate caregivers. The clinic's commitment to comprehensive care goes well beyond its doors or the operating room and encompass physical therapy, patient education, and ongoing support. Patients are not just names on a chart. They're individuals whose unique needs and concerns are understood and addressed.